Alright, Rogers, let's get started. Take a look at this chest X-ray. First question, describe your findings.
Well, I see some kind of shading. Yes, non-homogeneous shadows in both lung fields.
Shadows? Are you sure we're not looking at an abstract painting here, Rogers? They're called non-homogeneous opacities, not shadows. You're examining an X-ray, not a sunset. Moving on. Now, what are the possible signs and symptoms you would see in this patient?
Oh, that's easy. Fever, chronic cough, weight loss, night sweats, I think, wheezing.
Not bad, not bad. You didn't butcher the basics. But you missed some critical ones. Ever heard of finger clubbing? Or subcostal recession? How about tachypnea and hepatosplenomegaly? You know, those little details that scream the lungs are in distress. At least you didn't throw in runny nose, so I'll give you that. Okay, how would you treat this child?
Treatment. Anti-tuberculous therapy. I think you also give some rifampicin, isoniazid, pyrazinamide, ethambutol, for about 4 to 6 months.
Close. But close doesn't cut it. It's rifampicin, isoniazid, pyrazinamide, and ethambutol for 2 months, and then rifampicin and isoniazid for 4 to 6 months. Not forever, Rogers. Imagine if you were the patient, you'd be wondering why it feels like a lifetime. Now, let's see if you can redeem yourself in the next set. So this is the follow-up chest X-ray after 9 months of TB treatment. Give me 2 possible diagnoses.
Let's see. Probably multi-drug resistant tuberculosis, or maybe poor compliance with anti-tuberculous therapy.
Wow, look at you. 2 right answers. I'm genuinely shocked. It's like watching a miracle happen right before my eyes. Now, let's see if you can keep this momentum going. What information would you want from the caregiver in this case?
I'd ask if the child has been taking their medication consistently, if they've had any recurrent chest infections, and maybe ask about tuberculosis contact.
Maybe ask about tuberculosis contact. Rogers, of course you'd ask about that. You're also missing other key questions like persistent fever, night sweats, weight loss, and the child's HIV status. It's like you're making a grocery list, but forgetting the bread and milk. Don't leave out the essentials. Finally, how would you manage this patient?
Well, I guess I'd give anti-tuberculous therapy for multi-drug resistant tuberculosis, and maybe start antiretroviral therapy.
Maybe start antiretroviral therapy? Rogers, this is medicine, not a guessing game. Yes, anti-tuberculous therapy for multi-drug resistant tuberculosis, if confirmed, and definitely antiretroviral therapy. Definitely, not maybe. Also, remember you can use combinations like citovudine, lamivudine, and nevirapine, or efavirenz. No maybe about it. Well, Rogers, you didn't completely embarrass yourself. You're improving, but you've still got a ways to go. Try sounding a bit more confident next time, yeah.
I'll get it right next time, Dr. Chuluka.
You'd better. Or I might have to start charging you for all this extra tutoring.